name is Fuzzy. I'm going to be your nurse today. How are you?
I'm good. How are you?
Good. Can you tell me your name, date of birth, and where you at?
My name is Julie. I was born in July 3rd, 1988, and I am at your house.
Okay. Do you know what time is it now?
4 p.m.
Okay. All right. So I'm going to be doing your assessment, head to toe assessment. I'm going to be starting with your skin, nails, and hair.
Mm-hmm.
And what I'm looking at, what I'm going to be inspecting for the skin, I'm going to be looking at the skin uniformity. I'm looking at the skin color. I'm looking at any lesions, any like open sores, or any drainage from your skin. Then I'm going to be like looking at your hair. I'm gonna be checking for hygiene. I'm going to be checking for any flakiness. I'm checking for any baldness. I'm going to be assessing or touching or your hair texture, and I am gonna be checking your assessing your temperature, your skin temperature, turgor. For the temperature, I'm gonna be touching different areas in the body. For the turgor, same thing. And then I'm gonna be checking for the texture, I'm touching your body. Then for the turgor, I'm gonna just pinch you a little bit over this. And then I'm gonna be checking for your nails. I am checking if you have any cracking in the nails, any opening, any bold up and toes, still same thing, any crack. Then I'm gonna be checking for capillary refill. And here, because you have a nail polish, I'm just gonna kind of like push here. See, I'm checking for cap refill. Okay, then I am gonna be checking for clubbing. I'm gonna have you put your fingers together like this. I should see like a little opening there, which you do have. There's no clubbing in there. Then I'm gonna be moving to your face and your scalp. And for the scalp, I'm just gonna be like palpating for any like drainage or any tenderness, and tell me if you feel any pain or anything like that.
Okay.
No?
No.
Okay. Then I'm gonna assess your face. For your face, I'm gonna look for symmetry. For your head, I'm gonna look for its location. Then I'm gonna be looking at I'm gonna be doing some tests like cranial tests on it, facial nerve testing. So I'm gonna have you close your eyes tightly, and don't let me open them. Okay. I'm gonna have you smile. I'm gonna have you frown. I'm gonna have you whistle. Pop your cheek with air. Okay. Then we're gonna move on. I'm gonna test for the frontal sinuses. I'm just gonna press here and tell me if you feel any pain. No. And I'm gonna check for maxillary sinuses. Here I'm checking for the TMG. And just tell me if you feel any tenderness. Open and close your mouth for me. Open, close. Okay. Then I'm gonna be checking for I'm gonna be checking for sensation for the trigeminal nerve. And this is a cotton ball, and this is how it feels. I'm gonna touch your face. I'm gonna have you close your eyes and touch your face and tell me if you feel it, okay?
Yep. Yes. Yes.
Yep. Okay. Then we're gonna move on to your neck. And for the neck, we are checking for any distension, jugular vein. We're gonna be checking for if you have any like sores or opens, I will be checking for that too. And then I'm gonna be assessing your trachea, palpating your trachea and your tracheal tug. Then I'm gonna be palpating for your thyroid, and the way we're gonna do this, I'm gonna have you take a sip of water, but don't swallow it until I tell you, okay?
Okay.
And we're gonna be checking one at a time. All right. So I am checking for this one, but I'm gonna kind of push your trachea a little bit here so I can feel it. Can you swallow now for me? All right. And we're gonna do the same thing on the other side. Okay, I'm gonna be feeling for the thyroid here. I'm gonna push the trachea a little. Can you swallow for me? All right. Then we're gonna be checking for the 9 location of the lymph nodes, and the first one is right here behind you, like in the occipital area. Then behind the ear. Number 3 here. 4, 5, 6, 7, 8. One other time. 8, 9. All right. Then we're going to be doing your spinal accessory nerve. And I'm going to have you push against my hand. Push against my hand. Show your shoulder. Show your shoulder. Push. Okay. Perfect. And I'm going to have you also rotate your back and forth neck.
Yeah. Okay.
Yeah. Okay. Good. That's like, well, one is assessing for the strain and the other one is assessing for the range of motion. Then we're going to move on to the nose, mouth, and throat. Okay. And I'm going to be inspecting your nose. I'm going to look inside your nose, inspecting for any drainage, any opening, so. Then I'm going to palpate the nasal bridge, any deviation. I'm looking for any tenderness. Then I'm going to be inspecting your mouth. I'm just going to go ahead and put my gloves right now. And I'm going to be looking at your mouth. I'm going to be looking at your lips, any cracks, any lesions. Then I'm going to have you open your mouth. And I'm going to be looking for any filling, any dental decay, and I'm gonna press on your tongue, okay? And I'm gonna have you say ah. Okay. Say again. Ah. Okay. I can see your uvula and your palate, and I'm gonna have you move your tongue back and forth, like to left and the right. Okay. Right now, I'm gonna touch your tongue here. I'm gonna look for you. All right, perfect. And then we are gonna move to, and this one is my glass. Then we are moving to your ears. Mm-hmm. And for the ears, we're gonna be doing like 3 tests. The first one is the called whisper test. We're gonna do Weber test, whisper test, Weber test, and Renee. For the whisper test, I'm gonna whisper 3 words, and I want you to tell me what they are. Okay?
Okay.
And I'm gonna do it on the left ear and the right ear. Okay.
1, 2, 3. ABC.
Okay. All right. And for the Weber test, I'm gonna activate this tuning fork, and I'm gonna put it on the top of your head. And tell me when you can't hear it no more, okay? You're gonna kind of hear like a vibration. Mm-hmm. Tell me when it stopped vibrating, okay?
Okay, stop.
Okay. Same thing, I'm gonna do it behind your ear, and we're checking for the bone conduction behind the ear. And when it stopped, I'm gonna activate it and put it behind your ear. When it stops vibrating, you let me know, and I'm gonna move it in front of your ear, and we're gonna be checking for ear conduction. All right.
Okay. Okay.
We're gonna do the same thing for the right ear, okay? sorry, I should. Let's do it again.
Okay.
Okay, now you're gonna be listening for the.
Okay.
Alrighty. That's it for the ear. We're gonna move on to the chest, heart, and so on. So for the chest, I'm gonna be assessing. I'm gonna be looking for the. I'm gonna be inspecting. I'm gonna be looking for the respiration rate, for the rhythm, for the effort, for any use of accessory muscle. Then I'm gonna be palpating in a Greek pattern way. Just gonna feel. Do you have any pain anywhere? No? Okay. Alright, then I'm gonna be listening to you. And by the way, if I hear any abnormal sounds, I'm gonna be discussing bronchophony, echophony, and the whispered pictorially. Okay. Then I'm gonna listen. After I listen, I'm gonna have you turn to the other side. I'm gonna listen to your posterior chest. Okay. Take a deep breath for me. Okay. I want you to turn to the other side and I'm going to be listening. Yes, thank you. Hold it here. Again, I'm going to be inspecting for the same thing, for the respiration rate, for the rhythm, for the any use of accessory muscle. Then I'm going to be palpating in a Greek pattern way, feeling for any pain that patient may verbalize, any tenderness. Then I'm going to be palpating for the tactile primitus, and I'm going to have the patient say 99. Say 99, please.
99, 99, 99.
Okay. Then I'm going to be palpating for the thoracic expansion, and I'm going to have you take a deep breath for me. Okay. Alrighty. Then I'm going to be precaution. I'm going to do precautions. And I should hear like resonance. Okay. And then I'm going to be listening to you in a Greek pattern. Take a deep breath for me. Okay, and I'm gonna be palpating for the costal vertebral angle. I'm gonna ask you, do you have any pain, any
No.
tenderness? No? And same here. Okay, alright, then we're gonna move on to the heart, okay?
Okay.
I want you to lay back up
Lay down.
there. And for the heart, we're going to be inspecting for any related heart problems, such as hives. I'm looking for hives. I'm looking for any abnormal pulsation, any trill. And then I'm going to be verbalizing when the 5 areas that I'm going to be listening to. Then I'm going to be listening using the bell and the diaphragm of my stethoscope twice. And I'm going to be listening for the aortic valve, which is located in the second intercostal space, right border sternal. Then I'm going to be listening to the pulmonic valve, which is located in the left, in the second sternal space, left border second. intercostal space, left border sternal, and then I'm gonna move on to the second pulmonic valve or Erb's point, and it is located in the third intercostal space, left border sternal. Then I'm gonna be moving to the tricuspid valve, which is located in the fourth intercostal space, left border sternal. Then I'm gonna move on to the mitral valve, which is located in the fifth intercostal space, left mid clavicle. After that, I'm gonna be listening with my stethoscope for the same areas that I just verbalized. Okay, and if I heard any abnormal sounds, I will have the patient either lean forward or turn to the left lateral side so I can hear, so the chest can be closer, the heart can be closer to the chest. Now that I'm finished with the heart, I'm gonna move to the vessels, and I'm gonna I'm gonna palpate the vessels. I'm gonna palpate the temporal and the carotid. Then I'm gonna be listening to them, and I'm gonna palpate the rest of the arteries. Okay. Oh, I'm sorry, I forgot to use my bell. I always forget. So I'm gonna go back to the heart again and listen using my bell of the stethoscope. And this kind of stethoscope, I have to turn the bell right here so I can hear it. I'm sorry, I forgot. Alright, now I'm going to listen to the temporal. I'm sorry. And I can hear it really good. For the carotid, I'm going to listen. Then I'm going to go ahead and palpate. For the carotid, I'm going to palpate two one at a time. Then I'm going to move to the brachial. Just located fever. And I can feel it. And we're going to move on to the radial. Brachial. Radial, popliteal, just look at your right popliteal, posterior tibialis, posterior tibialis, dorsalis medius, and I can hear them really strong. Alright, okay, that's it for the heart. Now we're gonna move on to the abdomen, and I am sorry, I'm gonna have you for this right now. Thank you. Right now I'm gonna be inspecting, and what I'm inspecting, I'm looking at the contour. Yeah.
Would open.
I'm gonna open the window just for a little bit. For the abdomen, I'm gonna be inspecting for the symmetry, for the contour. I'm looking at the belly button. I'm looking at any open drainage, any like past surgeries. And then I'm gonna auscultate. I'm gonna auscultate before precaution or palpation. I'm going to listen to the fourth quadrant. very hyperactive. And then I'm gonna put color. And I should hit some to panic. Does it hurt anywhere? Okay. Then I'm gonna be gently, like lightly palpating. Can you tell me if you feel any pain?
Okay.
Pain?
No.
Pain?
No.
No. I'm gonna feel for the aortic pulse right here, located like just a little bit below the midline. The left side. Then I'm gonna deeply palpate and tell me if you feel any pain. Okay. Now I'm gonna palpate for your liver. So I am gonna have just do the hooking method. I'm just gonna feel. I'm gonna have you take a deep breath, okay? And let it go. And I don't feel nothing, and that is normal. I'm gonna palpate for your kidneys. And of course I don't feel nothing. And again, that's normal for the abdomen. Okay, that was it for the abdomen. And now we're gonna have to, we're gonna move on to the musculature system. And we're gonna start, the only thing we're gonna do while you're laying down, we're gonna do your range of motion of your hips. Mm-hmm. And I'm gonna have you bend your knee all the way up and